Okay, so this is going to be my week 8 final head to toe assessment for health assessment 2. So the first thing that I'm going to do is just knock on my patient's door, do my hygiene as I come in, provide privacy behind me. I'm going to acknowledge my patient, introduce myself, let them know what I'm about to do, how long it's going to take, and then thank them for letting me do my assessment. Next, I'm going to ask my patient their name and their date of birth, and I'm going to match it with their ID band. I'm going to assess for any allergies, and I'm going to assess their pain. So starting off, I'm just starting with my general appearance. So first and foremost, I just want to make sure that my patient is not in any acute distress before I get started. And once I establish that they're not in any acute distress, then I can move on to my level of consciousness. So first, I just want to make sure my patient is alert. So if they're having conversation with me, then they would be alert. Next, I'm going to ask them a series of 4 questions. So they should be alert and oriented to person, place, time, and situation. So person would be name and birthday, place would be where are you, time would either be the month or the year, and then situation would be why they're here in the hospital or why they're here in the doctor's office. So after my LOC, then I would move on to just kind of just getting, when we're having conversations, just getting a feel for their facial expressions, kind of their moods and behaviors, and then their speech. So their speech should be clear when we're having those conversations. Moving on to my skin and nails. So I'm just gonna first just start by just inspecting my skin. Basically, I'm looking at the color. Color should be appropriate to ethnicity. I'm looking for any lesions, wounds, or incisions. Next, I'm gonna move on to my nails. So I am looking at the color. So just by inspection, my nail beds are pink, and then I want to make sure that there's no clubbing on my nails, which there is not. You can even have them do a shamrock test, just if you are clubbing is pretty apparent, but if you wanted to do a shamrock test, you could, just to see that it'll be 180-degree angle that you would see. So then after that, I'm going to assess my cap refill, which it is pink on both sides. And so when you pinch the nail, it should pink back up in less than 2 seconds, and you want to do that bilaterally. So cap refill is present. And then after that, I'm just going to go through and palpate just kind of my skin. You want to do all extremities, upper and lowers, just to make sure that one extremity is not warmer than the other or cooler than the other. So moving on to my head, face, and neck. So I'm just going to start by inspecting and palpating my head for any infestations or any lesions on my head, which I do not have. So could make note of that. And then next, I'm going to be testing cranial nerves 5, 7, and 11. So cranial nerve number 5 is the trigeminal nerve. So what I'm going to do is, so there's a motor and a sensory. So the motor one, what I'm going to do is I'm going to have my patient open their jaw, and I'm going to push up with resistance, and I'm going to have them basically overcome the resistance. So try and keep it open. So I will demonstrate that. So have them open their mouth, and I'm just pushing up, and I am fighting that resistance, so I'm not letting them close it. And then the sensory part of that, so you would have your patient close their eyes. You would take a cotton ball and you would just swipe it down one side of their face, and then you would have them identify which side of the face they are touching. So that would be the sensory part. Next is going to be the facial nerve. So I would have my patient, you can do a series of things, so you can have them smile for you and show you your teeth. My smile is symmetrical, or you can have them raise their eyebrows and look, make sure that that's symmetrical, so raise them really tall, or you can have them puff out their cheeks. So any of those will work, determining whether the facial nerve is intact. Next is going to be the cranial nerve number 11, which is the accessory nerve. So what I'm going to do is I'm going to have my patient lift up their shoulders, and I'm going to try and push down with resistance and have them overcome that resistance. So have them not put their shoulders down when I push down. And then you're just going to have your patient move their head from side to side, which, bilaterally, which it's good. So cranial nerve number 11 would be intact. Next, just moving on to the eyes. So I'm just going to inspect my external eye for any redness, any discharge or drainage, anything like that. You would want to note that. Next, I'm just going to pull down my patient's lower lids and have them look kind of up. And then I'm just looking at the conjunctiva, which should be pink right down here, and then the sclera should be white. So just noting that. Next, I'm going to assess my pupils. So I'm going to go ahead and take off my glasses. Okay, so what you're looking for basically is PERLA. So pupils equal round, reactive to light, and accommodation. So what you're going to do is just by looking at my pupils here, my pupils are actually 2 different sizes, but in a normal patient, I mean, that may happen still sometimes. So one of them in my assessment, my eyes would not be Perla. But sometimes they're different, I guess. I don't know. Sometimes they're symmetrical and like even, but other times they're not. So I'm going to pretend that they are. So let's say I'm just looking at them. So they are equal, they are round. Let's say they're about a 4 on the pupil gauge, which normal should be like 3 to 5. And then I'm going to do my reaction to light. So I'm going to just go in, and my pupils should constrict as I go in, which they do. So they react to light, and then I'm going to do accommodation. So what I'm going to do is have my patient, let's say there's a clock on the wall, I'm going to have them just kind of look out at the clock for a few seconds and have them focus on that, and then I'm going to hold my pin light out and I'm going to have them switch to my pin light. So let's say I'm looking up here, switch to my pin light, and then I'm just going to move my pin light in and have them follow and move back out, and then I'm going to do that one more time and just have them follow and back out, so doing that for me, I was able to accommodate. So in my case, when I document, my eyes would be Perla. And then after I assess for Perla, I'm going to assess cranial nerves 3, 4, and 6. And I'm going to test those nerves by using the 6 cardinal fields of gaze. So what I'm going to do is I'm going to have this out in front of them, and I'm going to instruct them. I'm going to move my pin light, but I don't want them to move their head. I just want them to follow with their eyes. So I'm just going to go out and then back in, down and out. I'm going to go out and back in. And I was able to do that, and I don't have any extraocular movements, so cranial nerves 3, 4, and 6 would be intact. So then after my eye assessment, I'm going to move on to my ears. So what I'm just first looking for is my external auditory meatus. I'm just looking for any redness, any discharge, and I would want to look on both sides. If there was anything kind of funky going on, you could take an otoscope and look further in and kind of assess that more. But I obviously don't have any, so I would move on to my whisper test. So my whisper test is going to test cranial nerve number 8. And I am going to just demonstrate how I would do my whisper test. So if I was starting on, so let's say I'm going to stand on my patient's left side over here. So I would have them cover their right ear, and I would stand kind of right here, just right behind them, and I would just whisper in. So if I whispered 1, 2, 3, then I would have them repeat 1, 2, 3 back to me. So then if they were able to do that, even if they weren't, you would still assess the other side. So I would have them cover their left ear. I would stand just kind of right behind here, and I would whisper in 3, 4, 5, and then have them repeat 3, 4, 5 back to me. And then if something occurred where you, like they didn't do well on the whisper test, then you could do like a Weber and Rhine test. But since my whisper test would obviously be normal, then I wouldn't have a need to do that. So moving on to my nose assessment, I'm gonna go ahead and just start by lifting up my patient's nose, kind of looking at the internal structure for any asymmetry, any deformities, any inflammation, like a deviated septum. I'm just looking for all of those, which I do not have. Next, I'm going to assess for any drainage, and then I'm also going to assess bilateral nair patency. So I'm going to have my patient just hold one nair and breathe in and out. So both nairs are patent. Next, I'm going to move on to my mouth and throat. So just upon inspection, I'm just inspecting my lips. They are pink and they are moist. You just want to make sure they're not like dry and cracked, which could indicate maybe some like dehydration. Next, I'm going to have my patient stick out their tongue. And I'm just inspecting tongue, kind of throat too. I feel like kind of back of the throat, inspecting like those tonsils and stuff like that. And then, so tongue should be pink and moist as well. And then gums should be pink and moist. So if you kind of move, just kind of looking up at the gums there. Check for any like bleeding or anything like that, any lesions, which I do not have. My gums are pink and moist. And then after that, I'm going to test cranial nerves number 9 and 10. So I'm going to test the glossopharyngeal nerve and then the vagus nerve. So what you can do is have your patient stick out their tongue and say, ah, so, ah. And then what you're going to do is you're going to stick a tongue depressor back in the back of the throat, and you're going to elicit a gag reflex. And then as long as that gag reflex is present, then cranial nerves number 9 and 10 are intact. So after my mouth and throat assessment, I'm going to move on to my respiratory assessment. So First, I just want to inspect the anterior chest for any accessory muscle use. So any nasal flaring, muscle retractions, I want to note that first before I start auscultating my lung sounds. So after that, I'm going to go ahead and, so I'm going to do my anterior chest and then my posterior with my board. So I'm going to start with my anterior. And I would be doing this over bare skin, and I'm going to be doing it like a side-to-side pattern, and then I would want to be doing it on inspiration and expiration. So this is going to be my left upper lobe, my right upper lobe. Then I'm going to have my patient lift their arm up, and I'm going to do their right middle lobe, and then right lower lobe. And then I'm going to move over and do my left lower lobe. And then I'm going to go ahead and move over to my posterior lung sounds here. Whoop, sorry. Okay, so this is going to be my left upper lobe, right upper lobe, left lower lobe, right lower lobe, and then I could even go even further and do my right lower lobe again, and then left lower lobe again. And I would be doing it over bare skin on inspiration and expiration. I'm going to be doing it in a side-to-side pattern. Okay, so then after auscultating my lung sounds, I'm going to move on to my cardiac / peripheral vascular assessment. So the first thing that I'm going to do is just assess my patient's carotid pulses, and I'm going to do that sequentially. So those should be 2+ bilaterally. Next, I'm going to assess for any JVD, either at a 45-degree angle or a 90-degree angle. So just looking at a 90-degree angle, I do not have any JVD. Next, I'm going to assess for any edema. So basically, I'm going to just kind of go through and palpate. It's important to look kind of like at all extremities, not just the lower extremities. Even like, abdominal, edema, so like ascites, you could have like scrotal edema, even like flank edema. You can kind of have edema anywhere. So I feel like assessing just full body, looking for edema. But the main thing that you're looking for, like with heart failure patients, would be lower extremity edema. So if you're gonna look kind of here in like the shin area and then top of the foot and ankle area, so you just kind of palpate. Obviously I don't have any edema, and then you would do this kind of on both sides. And just making sure that's not pitting anywhere. So I do not have any edema. So then after I assess for my edema, I'm going to go ahead and listen to my heart sounds. So I'm going to use my diaphragm first, and then I'm going to go through and use my bell. So this is going to be my aortic, and this is going to be second intercostal right sternal border. This is going to be pulmonic, second intercostal left sternal border. This is going to be my Erb's point, third intercostal left sternal border. This is going to be my tricuspid, fourth intercostal left sternal border. And then my mitral is going to be left midclavicular line, fifth intercostal space. And that's also where you would take your apical pulse. So then moving on with my bell, this is my aortic, my pulmonic, my Erb's point, my tricuspid, and then my mitral valve. Okay, so then after I auscultate my heart sounds, I'm going to go ahead and move on to my peripheral vascular kind of assessment. So I'm going to go ahead and assess my radial pulses here. So I'm using the thumb side. I would want to do this bilaterally at the same time. Same with kind of all pulses. You just want to make sure, except your carotid. So all your other ones, you should be doing them bilaterally at the same time just to compare. So then I would move on to this one. So those ones are 2+ bilaterally. And then, let's see if I can show you. So this is where you would do your posterior tibialis here, and you would be doing these at the same time. I'll show you this other one here. And then kind of like here, outer ankle. So those are 2+ bilaterally, and then dorsalis pedis is going to be right here at the top of the foot here. So do the other one. So then those would be 2+ bilaterally as well. So then after my cardiac assessment, I'm going to move on to my GI slash GU assessment. Sorry. So just starting off by inspection, I'm just going to look at my belly. So I'm just looking at the contour, which I do have kind of a rounded contour, and then I'm looking for symmetry. So my abdomen is symmetrical, and then after I do my inspection, I'm going to move on and just listen to my bell sounds. Okay, so I'm going to do I'm going to sit back just a little bit. Okay, so right lower quadrant, right upper quadrant, left upper quadrant, and then left lower quadrant. And then after going through and listening, I'm just going to do some light palpation in all of those quadrants. So I'm going to just kind of take like 2 or 3 finger pads and just kind of lightly palpate in my right lower quadrant, right upper quadrant, left upper quadrant, and then left lower quadrant. And basically I'm just assessing for any tenderness and any distension. So, but also I feel like with inspection, you can also kind of assess for that distension as well, because sometimes it can be like pretty grossly distended. So just checking for that. And then afterwards, I'm gonna move on to my musculoscope. Okay, so I'm gonna start out by inspecting my one major, one minor for upper extremity and lower extremity. So for my upper extremity, I'm gonna do elbow and wrist. So basically what I'm gonna do is I'm just inspecting for contour, looking at the contour, and then looking at symmetry as well for both of these, and they are both symmetrical. Both of my elbows, I should say. And then I'm also going to look at my wrist. So I'm looking for symmetry, and I'm looking at the contour, which they are both symmetric. So those are good. Then for my lower extremity, I'm going to do the knee and the ankle. So I'll stand here. Okay, so knee, symmetrical, and I'm looking at the contour, and then ankle. I know it's hard to see, but looking symmetrical. And then I'm looking at the contour, which this one is also symmetrical. And you would be looking at those like at the same time, if that makes sense. So the next I'm gonna go ahead, I'm gonna stay standing and just do my range of motion. So I'm gonna do my elbow. So this is going to be, so this is extension, this is flexion, this is gonna be supination, and this is gonna be pronation. And then for my wrist, I'm gonna do flexion, and then extension, and then hyperextension. And you'd be doing the same thing on this one. So flexion, extension, and then hyperextension. So then lower extremities, doing my knee, and then, so, hold on, sorry, backtrack. So that was my range of motion, and then they are both, so you wanna make sure that range of motion is bilaterally like the same on both sides, which they are. So for elbow and wrist, they were both, range of motion was good bilaterally. So then moving on to my knee, so I'm gonna do flexion and extension, flexion and extension, which range of motion was bilateral on that one. And then for my ankle, I'm gonna move down because so I can show you this one. Sorry, I gotta move my socks. Just set my Q-tip there. Okay, so, sorry, okay. So we have inversion, eversion, you have plantar flexion, and then you have dorsiflexion, which is going up. So then after I do my, those are also, so range of motion is bilateral on ankles and knees for both of those. So after I do my range of motion, I'm gonna test for like my sensory function. So I have my Q-tip right here. So for, you're gonna do like sharp versus dull basically. So here I have my Q-tip, one side is my sharp edge, and then the other is like my dull edge here. So what I'm gonna do is have my patient close their eyes, and I'm just gonna touch, so if I'm touching over here, and then I would ask them, is it sharp or is it dull? And that was the dull side, so they would say dull, and then over here, I tested with the sharp one, so then obviously they would say sharp. And you can do that for upper extremities as well, sharp and dull on that side. You would do the same thing. So you would do dull over here, and then sharp over there, and just kind of testing both sides too, just to making sure that they're, one doesn't feel more dull on one side or more sharp on one side. That's important to ask too. So after my sensory function, I'm going to go ahead and do my muscle strength testing. So what I would do is for upper extremities, I would have them squeeze both of my fingers. And then what you want to do is you want to test against resistance. So what you can do is you can have them for upper extremities, you could have them hold right here and you could try and push down for resistance. But the hand grips, that's kind of hard to do resistance. So I would have them hold their arms up and then just push down for resistance. And then lower extremities, so what you're going to do is, so for dorsiflexion, so you would have them push down on your hands, that's plantar flexion. So plantar flexion, push down on their hands, and what you can do is try and pull their feet up and have them keep pushing down on your hands. So I'm trying to resist here, which I am. And then for dorsiflexion, so they're going to pull up towards your hands, you would try and push them down, and they're going to try and keep them up, which I did. So then after I test my muscle strength, which should be 5+ bilaterally on upper and lower extremities, that's your highest muscle strength. After that, I'm just going to assess my patient's gait. So you can either do a Romberg test to assess their gait, but then you could also do just watching them walk from the door and back, just making sure that they, their gait should be smooth and even, and just note if they use any assistive devices or anything like that. And then finally, just wrapping up my assessment, I'm just going to reassess my patient's pain. I'm going to ask and see if they need anything else. I'm going to offer them anything, anything to drink, a blanket, thank them for letting me do the assessment. I'm going to do my hand hygiene on the way out. But before I leave the room physically, I want to make sure that the bed is in the lowest position, that the wheels in the bed are locked, that their call light is within reach, side rails are up at least ×2, and that their bed or their chair alarm is activated and audible. And then do my hand hygiene on the way out.